So, why is she distressed? Because when she came in, after doing catheter care to one patient, she didn't wash her hands, and she came into this patient and started messing with them and filling them. She just did catheter care to that patient. Do you see bacteria on her hands, and now she's touching another patient? Women develop UTIs more than men. Our urethra is only about 2 inches long, where men's is 8. So bacteria can get in us quicker than anything. Okay. When it comes to systemic infection, what is the first thing that comes to your mind? What type of disease? A systemic infection is AIDS, because AIDS infects your blood, and your blood is all over your body, so the whole body. The nurse prioritizes the care of 4 patients, focusing on which of the following patients with a systemic infection: 14 with acute appendicitis, 80 with a urinary tract infection, 40 with AIDS, 50 with arthritis. 40 with AIDS.
Say that word again, please.
Systemic, meaning the whole system or the whole body. Inflammation has some cardinal signs. You guys know what they are? Okay, so redness of the skin, known as rubor, also erythema or erythemia. But for this purpose, I want you to know rubor, meaning red skin. Rubor. Edema, swelling, and it's usually around the wound. The nurse recognizes that a patient has had an inflammatory response in a surgical wound on the leg when he assesses a foul drainage from the wound, the affected leg cooler than the other, raised red welts that itch on the leg, rubor and edema around the wound. Because redness and swelling. Cardinal signs for inflammation. There are 4 cardinal signs for inflammation. Redness, swelling, pain, and heat. Always. Okay. The infection control practitioner plans an in-service on control of nosocomial infections. The program should concentrate on educating hospital personnel to aseptic practices, basically stating that we have to teach our nurses and our personnel how to stay clean, how to hand wash, how to keep linens clean, how to do a whole bunch of other things, but how to stay clean, aseptic qualities. So, the infection control practitioner plans an in-service on control of nosocomial infections. The program should concentrate on observing nurses caring for patients, screening patients who are admitted to the hospital, educating hospital personnel to aseptic practices, discharging infectious patients from the hospital, educating hospital personnel. When it comes to needle sticks, hopefully you guys never have to go through this. It's one of the scariest things in the world. I had one of my friends in the program with me actually have a needle stick at a site. The moment that happens, you go to your clinical instructor and you tell them. They immediately dismiss you to come back to school. come to school, you meet with the DON, you meet with the LVN supervisor. They give you this address and this form to our urgent care. You immediately have to go get your blood draw. They immediately will give you a vaccine for Hep and Hep B. Why? Because hepatitis is the most common contracted disease. It's not AIDS, it's hepatitis, and hepatitis is a very bad disease. When you go into your patient's room, if they're jaundiced, if they're yellow, if their eyes are yellow, they have hepatitis for the most part. You wear gloves and you be very careful, okay? Know what hepatitis they have. Hepatitis B, C, D are all blood and body transferred. Hepatitis A and E are oral and fecal transferred. So you can get it from their saliva or you can get it from their stool. Just know what you're allowed to touch and what you're not when it comes to hepatitis, all right? Most hospitals require that all needle sticks to a staff member be reported in order to begin proper treatment against hepatitis B. You okay?
I just got cramps.
Oh.
Probably because I'm too straight on this.
Probably.
Oh, yeah.
Those pants are tight.
Yeah, they are.
No good. You guys don't even know why I'm saying that. Do they all know? No. Huh?
No.
Okay, well, I
You're
don't say
pregnant?
anything.
Yeah. And it's huge already.
Wait, how do you say?
Yeah, but they're tight.
Yeah.
Yeah.
Not good.
That's probably why
Yeah.
I'm thinking like
Yeah.
that.
Okay. All right. The nurse observing standard precautions when she's disposing of linens contaminated with feces will don gloves only. It's just like a CNA. People poop on their sheets all the time. All you have to do is put on gloves, roll them up, carry them away from your uniform, and put them in the dirty linen basket. You're good. Okay? So, the nurse observing standard precautions when she's disposing of linens contaminated with fecal will don gloves only, which means put on gloves. Hand washing is the most important preventative measure for interrupting the chain of infection. We all know that. They always say hand wash, hand wash, hand wash. The nurse instructs the patient that the most important preventative technique for breaking the chain of infection is hand washing. When beginning the care of a patient, the nurse should wash his hands for a period of 2 minutes, and 30-second wash is adequate before starting the care of another patient. So basically what they're saying is, when you start the day, you want to wash your hands for 2 minutes. But then say I go into a patient's room, and now I have to go see the next patient. Well, after I go into this patient's room, I can go into the next patient's room and wash my hands for 30 seconds and then touch them. It's okay, because I did my 2-minute medical clean hand washing. Now I'm just doing 30 seconds in between each patient. I go for lunch, I come back, I do a full 2 minutes again. Then I see a patient, I go and see another patient, it's only 30 seconds. That's how it works.
Wash hands for 2 minutes and 30 seconds.
Prior to beginning care of a patient, the nurse will wash hands for a period of 2 minutes.
Does it say it's 30 seconds when have they answered?
Yes, it is.
Okay.
Okay. When you have to wear a mask inside a patient's room, know that their mask should be changed every 20 to 30 minutes. Because they catch a lot of that stuff that we're breathing in. So if we change it every 20 to 30 minutes, then we discard a lot of those microorganisms and then put on a fresh mask. We have less likeliness of pulling them or sucking them into our respiratory tract. let's see. When wearing masks, the nurse knows to keep it effective by changing it every. When you discard needles and syringes, what do you put them in? Known to be a puncture-proof container. A major threat to healthcare workers is blood-contaminated sharps. For safety, the nurse discards the used syringe in a wastebasket, sink, puncture-proof container, disinfecting soap. Options. Why would you put it, first of all, in the sink? What you gonna do?
Oh my god.
Disinfecting soap? Oh yeah, let's wash it off so we can reuse it again. What the hell? If your doctor does that, please let me know so I can go to a different city.
Oh, wow.
Okay. If the patient must be transported to another area, if they're in isolation and they have to be transported to another area, what you need to know is that patient needs to wear a gown and a mask because they're in isolation for a reason. So if we need to move them from their room to x-ray, we put a gown and mask on them and then transport them through the hospital. Okay? When a patient is in isolation and is to be taken to x-ray, the nurse will
Put a gown and a mask.
mask and gown the patient. Good job. So you didn't even have to know the answer. Okay. In order to minimize feelings of psychological and emotional deprivation, we should spend some extra time with our patients. Because a lot of these patients, their families are working, they never see them, they get really lonely. And emotionally, they will then think, nobody loves me, I might as well just die, I'd be better off dead. In order that they don't feel that way, it doesn't hurt to say, hi, Mr. Brown, how are you doing today? And as he talks to you, listen, nod, acknowledge the fact that Mr. Brown is a person and still sitting in front of you and very much just wants to have a friend. All right, Mr. Brown, thank you very much. You know, sir, I'm going to come right back and check on you. It was really good talking to you today. I hope you feel better, or I'm glad you had a good night last night. The patient's in isolation and may experience psychological and emotional deprivation. To help minimize these feelings, the nurse should be cheerful, spend extra time with the patient, protect the patient from additional infection, answer the call light quickly. Spend extra time with that patient. Because they already are in isolation, or they're already in that room all by themselves. Okay, we know that when we prepare a sterile fill, you have a paper, a chuck usually, folded in 4. You do it like this. Then you do it like this. You place it down. The 1 inches around the edge are considered to be contaminated immediately. So, where am I? Oh, this is where I'm at. The infection control officer recognizes that the need for more instruction on surgical asepsis when he observes a nurse continue to face the sterile field, places a sterile dressing on the sterile field, touches the edge of the sterile field with sterile gloves. It's now contaminated, so that is the wrong one. You cannot touch the 1-inch edges around the whole sterile field. Those are considered to be contaminated.